Years ago, when I was a cardiology fellow at Brown University, I got a call in the middle of a chaotic night in the cardiac critical care unit. The ER resident said, "I've got a patient here with earlobe pain." And I'll be honest with you, my first thought was, I'm juggling a million things right now. Why am I being pulled about an earlobe pain? Then he said one more sentence. "Just look at the EKG." I looked, and it stopped me cold. It was a heart attack, a real one, a big artery closing off. I activated the cath lab before I could even run down to lay eyes on the patient. When I got there, he was in genuine severe pain in his earlobe. A perfectly reasonable man who felt something was badly wrong and came in for it. We opened the artery and the ear pain went away. Now, I want to be really clear about something because it really matters. I'm not here to tell you to watch your earlobes. In my entire career, I've seen exactly one case of earlobe pain from a heart attack. One. That's the point of the story, not the moral of it. The moral is this: your heart does not always send its alarm to the address that you would expect. And if you only know the only movie version, the clutch your chest and fall over version, you can miss the real thing when it doesn't look like that, which it turns out is a lot of the time. So today, the symptoms of heart attack that people actually ignore. Why the heart does this. And the part that matters most, how to tell the difference between this is nothing and this is call for help. Stick around for that last part because that's the one that saves a life. I am Dr. Kaustubh Dabhadkar, a preventive cardiologist. And on this channel, we try to keep you out of the cath lab in the first place. Quick bit of plumbing, because once you get this, the whole list makes sense. Your heart doesn't have its own private pain hotline to your brain. Its nerves feed into the same spinal junction that collects signals from your chest, your shoulders, your arms, your neck, your jaw, even your upper belly. So when the heart screams, your brain gets the message, but sometimes reads the return address wrong. It thinks the pain is coming from the jaw, or the arm, or the back. That's called referred pain, and it's not a glitch. It's just old wiring doing its best with a shared line. And there's a small thing that tells you a lot. It's angina. It literally means to strangle or to choke. Whoever named it after the feeling of being throttled. That is the heart's real signal. And notice, nothing in that word says chest. And the numbers here are bigger than you would guess. In one of the largest studies we have, more than 400,000 heart attack patients, about a third showed up with no chest pain at all. A third. That number shifts a bit depending on how you count. Some studies are lower, but even the careful ones land near about there. So this is not a rare footnote. It also climbs with age. Under 65, most people do get chest pain. Past 65, most don't. And it's more common in women and in people with diabetes. And this is the part that makes it matter. The reason I wanted to make this video. When a heart attack shows up in disguise, people are roughly twice as likely to die from it. And not because the attack itself is worse, because it actually gets recognized late. The disguise costs time. And with the heart, time is muscle. That's an actual saying in cardiology. We tell it to each other because every minute an artery stays blocked, more heart muscle dies and does not actually grow back. Okay, so let's talk about the 6 that get missed. Number 1, jaw, teeth, or throat. People go to the dentist for this. They think it's a bad tooth or a tight throat, and there's nothing wrong with the tooth. If you get a deep, dull ache in your jaw or throat that shows up when you exert yourself and eases when you rest, that pattern is worth taking seriously. Pain that comes with effort and leaves with rest is a very hard thing to do. Number 2, upper back, between the shoulder blades. This one loves to disguise itself as a muscle knot. I must have slept funny, especially common in women. The tell is that a pulled muscle usually hurts more when you press on it or twist a certain way. heart-rate back pain doesn't care how you move. It just sits there, and it may travel. Number 3, arm or shoulder. And not only the left. Everybody knows left arm, but fewer people know it can be the right arm, both arms, or just a heavy, dead ache in the shoulder. So if you've been quietly reassuring yourself, it's my right side, so I'm fine, please don't. The side is not the safety check. Number 4, breathlessness or crushing fatigue with no pain at all. This is the sneakiest one, and it's the one I most want you to remember. Sometimes there's no pain anywhere, just sudden, out of nowhere shortness of breath, or a wall of exhaustion so heavy you can't climb the stairs you climbed yesterday. This shows up more in women, in older adults, and in people with diabetes, whose nerves may not carry the pain signal the usual way. If your body's ability to do normal things drops off a cliff for no reason, that is data. Don't explain it away. Number 5, nausea, indigestion, cold sweat, or lightheadedness. This is the I think it was something I ate heart attack. Upper belly discomfort, feeling sick, breaking out in a cold sweat, feeling like you may pass out. The one that gets me is the cold sweat. When someone is suddenly clammy and gray and nauseated, and it doesn't fit a stomach bug, my radar goes up every time. Antacids can't fix a heart. Number 6, the silent one, found later. And then there's the heart attack that barely announces itself at all. The person felt a little off for a day, chalked it up to a cold or a rough week, and moved on. Then weeks or months later, an EKG for something totally unrelated shows the scar. It already happened. These silent ones are again more common in people with diabetes and in older adults. It's a big reason we care so much about your risk numbers before anything ever happens, which I'll come back to. Quick thing before the most important part, and it matters more than a like. If you have ever had a symptom like one of these that you brushed off, yours or someone you love, or you caught one because something just felt wrong, tell me in the comments. Someone scrolling past this is going to need to read your story today. Now, I can feel some of you getting nervous because you had a weird twinge in your shoulder last Tuesday. So let me put my actual clinic hat on, because this is the part that matters most. And it's the part that keeps you from either ignoring the real thing or panicking over a pulled muscle. This is roughly what goes through my head and what I tell my own patients. I get more suspicious when it's new, something you have genuinely never felt before, not your usual bad back. You have had that for 10 years. When it's unexplained, no obvious pulled muscle, no bad burrito, no reason for it to really happen. When it comes on with exertion and eases with rest. Walking up the hill brings it. Sitting down takes it away. The heart is an effort organ, and effort-linked symptoms get my attention fast. When it travels or spreads, rather than staying in one pinpoint spot, you can put a finger on. And when it comes with company, a cold sweat, nausea, shortness of breath, that hard to describe sense that something is deeply wrong. There's an actual old medical term for that feeling. We call it Angor animi, which translates to the anguish of the soul. It's the patient who looks at you and says they feel like they're about to die. When someone says that, I've learned to respect it every single time. Stack a few of those together and the odds go up more if you already carry risk. High blood pressure, diabetes, high cholesterol, smoking, or a family history of early heart disease. Same symptom in a 30-year-old and a diabetic smoker and at 60 are not the same symptom. None of this is a diagnosis you can make from your couch. And it's not meant to be. Honestly, it's often hard to know, even for us. It's a threshold. It's when to stop talking yourself out of it and let someone with more equipment like an EKG or labs that they can draw sort it out for you. One story has always stuck with me. In 1955, a sitting president of the United States, Dwight Eisenhower, spent a day golfing, ate a hamburger loaded with onions, and that evening got what everyone around him, including his own physician, chalked up to indigestion. It was a heart attack. The most protected man in the world, a personal doctor at his side, and it got called an upset stomach from onions. And it isn't just the famous. I know of a physician, or actually multiple physicians, people who do this for a living, who felt something off, decided it was heartburn from a spicy dinner, and waited at home until it didn't get better. If it can slip past the precedent's doctor and past actual doctors feeling it in their own chest, it can slip past any of us. That's not anyone being foolish. It's how convincing, it's probably nothing, sounds from the inside. So the plan is simple. If something feels like it might be your heart and it's ticking those boxes, call emergency services. Where I am, that's 911. Do it early. The worst that happens is you get checked and sent home a little embarrassed, and I promise you that no one in ER is rolling their eyes. I will tell you exactly how I think about it as a cardiologist. I would so much rather see 100 false alarms than miss one real heart attack. So come in, let the specialists rule it out. That is literally what we are here for. One more thing, and this is important. Do not drive yourself. The ambulance isn't just a ride. They can put an EKG on your chest in your living room and start treatment, as well as call the cardiologist and have them get to the hospital. That ER resident who called me about an earlobe, the reason that story has a happy ending, that somebody got an EKG when the symptoms didn't fit. And can I tell you how wild it is that we can even do that today? The first EKG about 120 years ago came from a machine that weighed around 600 pounds. It needed its own cooling water. It took several people to run, and the patient had to sit with both hands and the foot dipped in buckets of salt water. The man who built it won a Nobel Prize for it. Today, that same test is a couple of minutes, a few stickers on your chest, and can catch a heart attack that's hiding as an earache. That is the whole game. A low threshold to check. And if you want more of this plain hard facts, no fear, no hype, subscribing genuinely helps. That's the entire reason this channel exists. To get honest answers in front of people before they even need them. So to bring it home, your heart doesn't always send its alarm to the address that you'd expect. It can be your jaw, your back, your arm on either side, plain breathlessness, an upset stomach with a cold sweat, or almost nothing at all. You don't need to memorize a checklist or walk around scared. Just know the pattern. New, unexplained, brought on by effort, spreading, or showing up with company like a cold sweat, or that sense of impending doom. And keep a very low bar to get it checked. But here's the thing that bugs me about all of it. By the time you're reading your body for warning signs, the disease has usually been building quietly for years. The best heart attack is the one that never gets the chance to happen. And you can actually see it coming long before any symptoms. In a handful of numbers, most people never get checked. That's what the next video is about. There's a single test that can show plaque in your arteries before you feel a thing. And I'll tell you who should get it. That video is coming up soon. If this was useful, comment the word signs and I'll send you our one-page guide on the warning signs and when to act. And if you want to get ahead of all of this, there's a free 2-minute check at heartdockkatie.com/start that tells you which of your heart numbers are optimal and which need attention. The link's below. Take care of that heart.